Cognitive communication disorder. Think about it, talk about it. Human beings are social. We rely on intact communication abilities to build relationships, to enjoy fellowship with others, to interact with our community, and to co-participate in life with members of our circle. We also rely on intact communication abilities to gain and maintain employment for financial stability and well-being. Difficulty communicating can therefore prevent people from participating in life roles that require communication, which, let's face it, includes almost all of the life roles. So what is cognitive communication disorder, or CCD? Words and the ability to use and understand them live in your brain. And while the left side of the brain is very important for words and language, there are millions of brain cells that work together throughout your entire brain, in the left and in the right, when you communicate. These brain cells from all over the brain must communicate so that you can communicate in everyday life situations. If these pathways are damaged or dysfunctional, and or if the communication hubs are damaged or dysfunctional, then the ability to communicate is negatively impacted. Sometimes this is because thinking problems, like problems with attention, concentration, memory, and problem solving, lead to problems communicating effectively. This is cognitive communication disorder, or CCD. CCD includes difficulties in communicative competence like listening, speaking, reading, writing, conversations, and social interaction that result from underlying cognitive impairments like attention, memory, organization, information processing, problem solving, and executive functions. The American Speech-Language Hearing Association and the College of Audiologists and Speech-Language Pathologists of Ontario define CCD as communication impairments resulting from underlying cognitive deficits due to neurological impairment. So how does someone acquire cognitive communication disorder? It can happen because of a traumatic brain injury, like when something penetrates the head, or when someone has a nasty fall, or a bad vehicle accident. CCD can also be caused by a stroke, like a blockage stroke that cuts off the blood supply to the brain, or a rupture stroke where there is bleeding within the brain. CCD can also be caused by other types of brain damage, such as infection, brain tumor resection, and others. Progressive neurological disease can also cause CCD. But this talk will focus on CCD after sudden acquired brain injury. How do I recognize cognitive communication disorder? CCD happens not just because of damage to the lobes you know that are made of gray matter, the frontal, temporal, parietal, and occipital lobes, and even the hidden insula lobe, but also because of damage to important connections between these brain areas, and these connections are called white matter tracts. Think of them as connecting highways or extensive telephone systems that help these areas communicate. Different locations of damage to these specialized areas and their communication lines will lead to different profiles of communication problems. Two examples are shown here. The one on the left, with pretty good memory and self-awareness but poor attention and visuospatial abilities. The one on the right with pretty poor memory, attention, self-awareness, and executive function, but pretty good visuospatial abilities. You can think of a tuner or a soundboard where the different channels are different cognitive skills, and someone may have impaired to functional or normal abilities in the different domains. The combination of those cognitive abilities and limitations will influence communication and can lead to a debilitating cognitive communication disorder. Some cognitive and communication skills will be stronger than others, and people may have one or more of these problems. Difficulty planning, difficulty organizing. And these difficulties extend to planning and organizing sentences in conversation. Difficulty modifying plans, difficulty managing multiple responsibilities. Problems processing written information. Trouble with concepts of time and money. Difficulty understanding and managing personal, financial, and legal matters. And these matters, unfortunately, often increase in importance and in frequency after someone has a brain injury. Difficulty reading emotions, difficulty managing emotions, difficulty understanding humor. Now you can more easily understand how one or more of these different problems will make it difficult to communicate effectively with family, friends, co-workers, customers, and other communication partners. Some people with CCD are often unaware of their deficits and their mistakes, which can make recovery and communication even more difficult. People with CCD may also have difficulty self-monitoring, following rules, and predicting consequences of their actions. Cognitive communication disorder recovery. Even the mildest CCD can reduce engagement in friendly and familial relationships and can introduce challenges to interactions with people in the community. CCD may also negatively impact employment, and many with CCD are unemployed or underemployed. The subsequent financial hardship can be devastating. The impact of CCD extends beyond the brain injury survivor, rippling outward to family members or friends who may be serving as care partners. Following a brain injury, changes occur in the brain which help it to recover. And as a result, people with CCD often see dramatic improvements in their cognitive and communication abilities in the first few months to a year, even without treatment. But in many cases, CCD still remains following this initial recovery period. The good news is that research has shown that abilities can continue to improve for many years. And it's important to stress that recovery after brain injury is not over after 1 year. Because CCD is a relatively new diagnostic category, it too often goes undiagnosed. Hopefully, more education and advocacy, like this video and others, will help to improve identification and recognition. This is important because therapy is proven to help improve cognitive and communication abilities. Speech-language pathologists, occupational therapists, neuropsychologists, and other appropriately certified and experienced healthcare providers are important for diagnosis and treatment for people with CCD. So help us spread the word about cognitive communication disorder. Think about it, talk about it. An informed community is a healthier community. We must work together to help people live well with cognitive communication disorder.